Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started.
Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. This is actually episode 20, and I can't believe how fast time has flown by and that we're already at episode 20 of the podcast. I just want to say a massive thank you to everybody who has listened, who has shared it with friends, who has left comments, left reviews. I appreciate it so much. I had no idea how well received the podcast would be or what it would even turn into when I first started doing it. And it has just been like beyond my wildest expectations and has been such a fun project. So thank you so much for being here. I can't believe we're at episode 20. And for episode 20, I thought I would start to dive into some of the specific injury conditions that we see really commonly in dancers. So today's episode is all about ankle sprains. And before we dive into this, I just need to make it clear that the information in today's podcast is in no way, shape, or form medical information and is not meant to be diagnostic or anything like that. It is just for informational purposes only. If you feel like you need medical information, I encourage you to book in with your medical practitioner. So again, the information is for informational purposes only. So I decided to start with ankle sprains in terms of like the conditions that we're going to get into throughout the future podcasts. Partly because it is one of, if not the most common injury that we see among dancers. So if you remember way back when one of the first podcast episodes, we talked a little bit about like injury incidence and prevalence, and roughly 50% of injuries that we see in dancers come from foot and ankle. So those are sort of different injuries, but one of the things that makes up a big proportion of those is ankle sprains. And ankle sprains are one of the most common injuries that we see in general among the population. So not just among dancers, but if we look at any athletic population and even just the general population, the incidence and prevalence of ankle sprains is quite high. So it's no surprise that that also carries forward into a dance population, and especially then when we consider that 50% or more of dance injuries are foot and ankle injuries. Ankle sprains are going to make up a fairly large portion of those. When we are talking about ankle sprains, it's really important that we just, at a very, very basic level, differentiate a sprain from a strain. So anytime we are talking about a sprain, so SP in the body, we are talking about a ligament, so ligament injuries. So these happen commonly at the foot, the ankle, the knee, other areas in the body as well, but we are always referring to a ligament injury if we are talking about a sprain. If we are talking about a strain, so ST, we are talking about muscle injuries. And so that's the biggest differentiator. I think a lot of times these terms get used a little bit incorrectly in the general population because people think just they go more off of body part as opposed to like actually structurally what's going on. So sprains are ligaments and strains are muscles. So if we're talking about like a hamstring injury, we're going to be talking about a strain, but generally ankle sprains are usually ligament injuries. Well, sprains are always ligament injuries, and most of the ankle injuries that we see fall into that category of ankle sprains. There's a lot of different ligaments within the ankle that can be the thing that is being injured or the ligaments that we are spraining, but there is one particular ligament that makes up a big proportion of ankle sprains that we see. So we have ligaments on the outside of our ankles, so where your like ankle bone is, they come down from that on the outside, and then we also have ligaments on the inside of the ankle. And about 3/4 of the ankle sprains that we see affect the ligaments on the outside of the ankle. those are by far the much, much, much more common ankle sprain injuries that we see. And then only about 25% of ankle sprain injuries happen for the ligaments on the inside of the ankle, or what we would call a high ankle sprain, which is actually the ligaments in between the tibia and the fibula in the lower leg. So it's a little bit higher than like kind of the main ankle joint area. So the ligaments on the outside of the ankle, there's multiple ones, but there's one in particular called your anterior talofibular ligament, or often we just refer to it as ATFL. And that is the one that is the most common ligament injury that we see when we're talking about ankle sprains. And you don't necessarily need to know any of this information, but just understanding that commonly what we're seeing is ligament injuries on the outside of the ankle. And the reason that those ligaments are the ones that are the most commonly injured has to do with the mechanism of injury. So the most common way that people are going to suffer an ankle sprain injury is by rolling their ankle, and usually rolling it outward. So, in sort of more dance terms, rolling it into kind of like a sickled position in through there. And so when that happens, and especially if our foot is in a more pointed position, so happening on, say, like demi-point or on point or something like that, that ATFL ligament is the primary ligament that is going to be injured in that position, just because of its orientation and because of what its role is in those positions. Ligaments in general, so everywhere in our body, ligaments in general are there to provide stability. They're there to control movement at the joint. So ligaments connect bone to bone. So we have ligaments where we have connections between different bones. And so when those ligaments are put under strain, and then there's a force applied to them that's maybe not in the desired direction, or a force applied in a direction that causes like excessive strain, that's when we see these injuries happen to these ligaments. So in the case of an ankle roll, imagine you're, say, on demi-point and your foot starts to go into like a bit of a sickled position and you roll out of that position. That's going to strain or like stretch that ligament in a direction where it then becomes injured. So when we talk about ankle sprains, or any sprain in general, we classify these, or we can grade sprains on sort of a scale of, we use grade 1, grade 2, and grade 3. And so a grade 1 injury would be the most mild form of a sprain injury. And that's where we have like sort of probably stretched out that ligament and maybe torn a few fibers of it. Ligaments are made up of fibers. The easiest way to think about them is almost like rope. So, if you picture a rope and it's got all of those little individual like filaments or fibers that make up kind of a rope in through there. And if you imagine that rope's been like rubbing against the edge of something and you can see sort of that rope start to fray a little bit, that's kind of what can happen in a ligament injury. And so if we're talking about a grade 1 sprain, sometimes we'll just get like a stretching out of that ligament, but more often than not, we are getting a tearing of some of those fibers, but it would be a very small percentage. So certainly under 25% of the fibers, and often even maybe less than that, who knows? So that would be like our grade 1 injury. And like I said, we would consider that a fairly mild ankle sprain injury. Then we would have our grade 2 injury, which would be more of like a moderate ankle sprain injury. And in that case, we definitely have tearing of some of the fibers of the ligament, but it's not completely torn. It's, they sort of say between 25 and 50% of the fibers. There's no way that we quantify that, but we know that it's, more serious than a grade 1, but the ligament itself is still somewhat intact. And then our grade 3 ankle sprains or grade 3 ligament injuries would be a complete rupture of a ligament. So all of the fibers get torn in that case. And that's definitely a much more severe injury. The healing timeline for a grade 3 injury is significantly longer than, say, a grade 1 injury. So in terms of healing timelines, a grade 1 injury could be anywhere from a couple of days to maybe 2 weeks or so. A grade 2 injury is often somewhere in the neighborhood of 6-ish weeks. And then a grade 3 injury is usually going to be probably around 12 weeks or so of recovery in order for people to get back to function. So those numbers are, of course, like very, very generalized, but just to give people an idea, because I think there's this like perception that like, oh, I just sprained my ankle. Oh, I just rolled my ankle. It'll be better in like a couple of days, even when it's been a really significant injury. So even these grade 3 injuries, people after a week or two will be like, oh, it was just an ankle sprain. It's fine. And they sort of like go back to trying to get to activity. So we definitely want to be able to differentiate in terms of, okay, was this a grade 1? Was this a grade 2? Was this a grade 3? So that we are treating it appropriately when we're looking at like rehabilitation and timelines and things like that. One of the biggest reasons why we have such high rates of ankle sprains and why they are one of the most common injuries that we see is because they have a really, really high rate of reoccurrence. So like I was just saying, our ligaments are there to provide stability to the ankle joint. And if we've injured those, and especially if we've injured them and not necessarily gone through like really comprehensive rehab programs, we may be lacking stability at that joint going forwards. And again, we see this all the time. People who are like, oh yeah, I rolled my ankle, I, took it easy for a couple of weeks and then went back to activity, but potentially without actually really assessing, like, were you fully able, like, were you back at full function at that point in time? Or was there potentially some instability or some laxity that was present? And that then leads them to be way more susceptible to future injuries and sort of what then become kind of these chronic ankle sprains. So a really common story that we hear clinically is people who are like, oh yeah, I like had their first ankle sprain potentially like in adolescence. Like it's often in high school. They'll be like, oh, I was playing basketball or whatever, dancing, whatever it is. May have their first probably like moderate to significant ankle sprain at that point in time. And then they'll sort of continually experience them every year or two kind of after that. And usually they'll sort of report like, oh, now like my ankles are, so used to it that it's not even a big deal. I just like roll it and it's like fine, within a few days. And that's often because they've fully torn the ligaments like the first time round. And then potentially there isn't really a whole lot of ligament left there to damage in subsequent injuries, but that's not going to prevent other structures from being damaged. So it is still a problematic injury when people get into these instances of chronic instability where they get these recurrent ankle sprains or ankle rolls that continue to happen. So this is one of the reasons why we want to make sure that, especially if it is a first-time ankle sprain injury, but realistically any ankle sprain injury, we want to make sure that we're taking these seriously and that we are like fully rehabbing these injuries so that we don't end up with these kind of chronic instabilities or recurrent ankle sprains going forwards. Another sort of interesting thing that maybe ties into this a little bit as well is there's some research that shows that younger people are more likely to experience ankle sprains than older people. So there's a higher rate of them that happens in sort of childhood, adolescence, and even into young adulthood. And then as people get older, they're less likely to experience ankle sprains. And some of that probably just has to do with the fact that like younger people are maybe more likely to participate in sports and activities. So if you think about kids who are still in school, they're doing like gym class at school, they might be playing on school sports teams, they might be playing community sports. So maybe they're just in situations that are more likely to do that, whereas we have an adult population who tends to not participate in sports so much. So that could be part of it. But also, younger people tend to be a little bit less stable in their joints. So they have more laxity or more flexibility or pliability in their ligaments in general. So they're not going to necessarily be as stable in those joints. So that may be a reason as well why we see an increased rate of ankle sprains happening sort of in younger people, and then this trend towards them decreasing in incidence as people get a bit older. This is significant for our dancers because the majority of dancers start dancing when they're quite young. And if they are then sustaining their first and potentially second and third and fourth ankle sprain while they're still in those sort of like childhood to adolescent years, this is going to have huge consequences for their function going forwards and their sort of ability to create stability in the ankle structures in through there. So we want to make sure that we're sort of preventing as many ankle sprains as we can, but also if we have dancers who do suffer an ankle sprain, that we're making sure that they fully rehab the ankle sprain so that it doesn't become sort of a chronic or a long-standing issue. The other thing that sort of really pertains to dancers as well is, again, there's some research that shows that we have an increased incidence of ankle sprains in females versus males. And we know that dance tends to be a female-dominated activity, especially at the younger ages, where there are more females that participate than males. And we have a higher rate of ankle sprains. So again, we're just going to see a higher proportion of ankle sprains in young dancers because we have that age predisposition. They're participating in high amounts of activity, and then we have that sort of female factor on top of it. I don't know that they've done a lot of research to dive into the reasons why it's more prevalent in females, but I'm sure that there are things, there's some differences in terms of ligament makeup and ligament laxity that are linked to hormonal differences in males versus females, and it probably has something to do with that. So, what are the signs and symptoms of an ankle sprain? Well, usually, like I said, there's going to be some sort of a mechanism of injury that involves some sort of a rolling of the ankle, either into that inversion or like rolling outwards position, or sometimes they are eversion or rolling inwards type sprains, and then we're more likely to have a sprain of the inner side of the ankle in through there. So usually there's a mechanism of injury that sort of accompanies what we would expect for an ankle sprain injury. And then usually the next sort of common sign that we'll see is that people will have pain, and the pain can be localized to anywhere around the ankle, but commonly, again, it's going to be the outside, and usually it's like kind of right below or a little bit in front of that outer ankle bone in through there. And that kind of corresponds with where the ligaments are located. And so people will have fairly localized pain, but you can get pain that radiates or spreads down into the foot a little bit. It might spread a little bit up into like the lower leg. Some people will even get pain in like the Achilles area or places like that. But generally we're going to have some pain associated with an ankle sprain. We may or may not have swelling. If we have a grade 2 or a grade 3 ankle sprain, we will almost always have some swelling present. And especially in more serious ankle sprain injuries, it's not uncommon to have like really significant amounts of swelling. So sometimes we'll see, and like quite rapidly after an ankle sprain, somebody will roll their ankle and within like 30 minutes, it'll just balloon right up and be like quite large or quite dramatically swollen in through that area. And again, that swelling might be more localized to the outside of the ankle, but it can kind of spread anywhere, and it's not uncommon for it to sort of spread down into the foot and pool in the foot and potentially end up like, you know, people end up with little like sausage toes almost, where it spreads into the toes and things like that. Along with that swelling, we might have bruising, and again, the bruising can vary in severity. So in a mild ankle sprain, there actually might not be any bruising present, but in a more moderate or severe, we can actually have some pretty dramatic types of bruising. And again, it will often pool into that foot. So people will end up with a lot of bruising along the kind of like outside edge of their heel, or sometimes even into like the sole of the foot a little bit, or down into the toes. There can be like quite a lot of bruising, and that's from the ligament fibers tearing. They bleed when that happens, and so then the blood just kind of like pools under the skin, and we get this really dramatic bruising in through there. So pain, swelling, bruising are probably the most common like sort of first signs that we'll see in an ankle sprain of varying degrees depending on the severity of the injury. We will usually have a decrease in the range of motion available. And so this sometimes is due to the swelling. Like if there's swelling in the joint, then it's going to limit how much the joint can move. It can sometimes be due just to pain limitations, but we will often have a decrease in range of motion available, especially to fully flexing the foot and then fully pointing the foot. So those are often the ones that become quite limited. Flexing the foot fully up is one that is problematic if we don't restore that range of motion. And I'll talk about that in a second in terms of like sort of some of the longer term consequences of what we see. We will usually have a decrease in strength. So when there's been an injury in that area, the body's naturally going to try and protect that area. And one of the ways it does that is it like doesn't allow the body to generate sort of a lot of strength and kind of force around that area as a way of protecting it. So we'll see a decrease in strength. We can also have muscle strains that happen at the same time we have that ligament sprain happen. And this is actually quite common that we'll see people have an inversion ankle sprain. They'll sprain the ligaments, like potentially that ATFL ligament, but they might also strain the muscles down the outside edge of that ankle. And especially the peroneal muscles are the ones that run down the outside of the leg and into the outside of the ankle. And so that some of that weakness might come from the fact that there's actually a muscle injury going along in conjunction with the ligament injury in through there. And we do see that quite commonly. So we'll often see a decrease in strength. And then we will usually see a decrease in what is called proprioception. And so that is basically our body's ability to know where it is in space. And the easiest way of thinking about this, and especially when it comes to like an ankle joint, is like the stability or the balance available in there. So one of the big things that people will report after an ankle sprain is that it just feels like really wobbly or unstable. And there's a couple of reasons for this, but one of the big ones is we have receptors in our ligaments that like feed information back to our body, back to our brain or nervous system, that tell us where we are in space at any given time. And when we have an injury to those ligaments, we lose those like receptors or the receptor's ability to communicate those messages. And so we have this decrease in kind of proprioception that happens. And so this is one of the big things that we often need to work on, like retraining as we are rehabbing an ankle sprain type injury. The other big thing that we see, and this is sort of a secondary result of an ankle sprain, is that we then see compensations happening elsewhere in the body to sort of accommodate for this injury that has happened in one of the ankles. And so we'll see compensations happening sort of usually further up the chain. So maybe the knee on that side, or very commonly kind of the hip on that side, we'll see things happening. But really those compensations can be happening anywhere in the body. And so our bodies are really, really, really smart and able to adapt to certain situations. And so if we've had an injury in a specific area, but we're still asking our body to do things. So at the beginning, it might just be like we're still walking, or we're still like, trying to like move around or do things like that. Our body's going to figure out a way to be able to try and do that activity. And later on in the sort of rehab process, and especially if people aren't like really thoroughly rehabbing an injury, and maybe they still have a movement limitation or a proprioceptive limitation or things like that, but we've gone back to dance and we're asking the body to do these really complex high-level movements, the body's going to figure out a way to do that by compensating somewhere else. So this is one of the things that I see most commonly in the clinic is lots of people who are coming in for seemingly unrelated things. Like they might be coming in for a hip issue, or they're coming in for low back pain, or whatever it is that they're coming into the clinic for. And when you start to dig into their past medical history, and I'll always ask people, have you ever had any other significant injuries in the past or something along those lines during the intake? And oftentimes people are like, oh no, or maybe they'll say, oh, when I was a kid, I broke my arm or whatever it was. But they often don't ever report ankle sprain injuries. But it's one of the questions that I almost always will specifically ask, have you ever sprained your ankle or rolled your ankle? And a lot of times people are like, oh yeah, I just have really weak ankles. They roll all the time. But they haven't thought to report that as like an injury, because it's something that to them is like seemingly normal at this point because it's become such a chronic thing. And when we look into things, it can often become apparent that maybe some of these issues that they're having later on down the road in their hip or their back or their neck or whatever it is related to the fact that their body is still compensating or protecting for this injury that happened potentially even years before. And so this often comes up in the history when we're like asking questions, and sometimes it doesn't. So sometimes I don't specifically ask that question, or it just doesn't really come up, but we'll start looking at movements, and they'll come in and say, oh, I get this like pinching in my hip every time I do a squat. And we like sort of start to analyze movements and look at a squat, and I'm like, well, you actually like can't move your ankle or like get enough ankle flexion going on to actually get deep enough in a squat or whatever. And so then the hip's compensating, and everything kind of feeds up the chain. And often then, and so I'll sort of look at it and think like, oh, there's something going on in this ankle. And then they'll be like, oh yeah, I had a really bad ankle sprain when I was like 15 or whatever it was. And so It is one of the biggest injuries that I would say leads to other compensations in the body that are more long-standing or things that come up like later down the road that people don't necessarily directly link back to an ankle sprain. And so one of the biggest things that we see is people not fully restoring their range of motion after an ankle sprain, and specifically into that ability to flex, or it's called dorsiflexion, but like our ankle's ability to flex fully up. And for us to be able to get into a plie or a squat or land from a jump, we need to be able to fully flex that ankle in through there. And people will often not notice that lack of kind of range of motion or that limitation that they have because their body has made up for that movement somewhere else. So they're either bending their knee more or bending their hip more or doing something to compensate for that. So until we actually like really look at that movement, and often we measure it to like compare side to side or whatever, then it'll become apparent that that was like never fully restored after an initial ankle sprain. The other thing that we commonly see is this lack of proprioception. So if we have less stability and less proprioception in that ankle joint, then again, we're more likely to be compensating somewhere else further up the chain in order to be able to try and stabilize that area. And this is why ankle sprains can lead to symptoms that seem very remote and not at all linked or related. Things like neck pain or shoulder pain or things like that, because our body, again, it's smart, but it will come up with any strategy possible to provide stability to that area. So if we're not getting the proprioception from the ankle itself, we might end up like tensing up or doing something with like our opposite shoulder to try and stabilize that area. And again, this is all happening unconsciously, but over time, this can lead to issues like in the body that present and manifest as something completely different. But when we actually look at like the whole body and how the body's functioning as a whole, it becomes apparent that there's something going on from this like old ankle issue that was never fully resolved. So this leads me to sort of my final point, and I'm going to kind of wrap things up talking about ankle sprains. And that is that no ankle sprain is an insignificant injury, no matter how mild it might seem at the time or it might appear at the time, because oftentimes the consequences of this injury are way more significant down the road than we think they are. So I would encourage everybody, if you ever have an ankle sprain, or if you're a teacher and your students have an ankle sprain, to really get it checked out. I think because they're such a common injury, they've been kind of normalized within society. And so people, and like parents even, you know, their kid has an ankle sprain and they're like, oh yeah, they had an ankle sprain. They just kind of took it easy for like a week and then they went back to dance. There isn't this urgency of like going and getting it checked out by a medical professional and like doing any sort of rehab, because it's so common. People just think, oh, it's an ankle sprain. Like everybody sprained their ankle, or like, you know, it happens to kids all the time, or that type of thing. But if we are just kind of like leaving these and allowing people to return to activity when potentially they might not be fully functional, so they might be lacking range of motion, they might be lacking strength, they might be lacking stability, we are setting them up for other issues that are going to come up later on down the road. And I think that this is an even bigger deal in dancers than in other athletic populations, because we have such a heavy reliance on our feet and our ankles. They're incredibly important tools for us, and the amount of like articulation that happens through the foot and ankle and the amount of time we spend jumping, so we need our feet and ankle to be able to shock absorb for us and to be able to create those movement patterns, and our ability to go on demi-point or go on point or things like that. The foot and ankle are just so critical in a dance perspective. And then we also don't have a lot of external supports available to us in dance. So in other sports, like if you imagine, I don't know, like a ski racer at like a very like kind of extreme opposite end, they're in like a really rigid ski boot that's almost like a cast and very similar to like what we would put somebody in like a walking boot if they broke their foot or something like that. So if they've had an ankle sprain, that might not impact their sport quite as much because they get that external sort of support from a boot. Or in other sports, we might have a better ability to wear like braces or supportive things kind of like for the foot and ankle if there are issues going on. But in dance, I mean, sometimes we're wearing dance shoes, but even dance shoes provide very little in the way of support or stability for our feet and our ankles. And in a lot of instances, we're actually dancing barefoot or in socks or things where there's no support and structure available. So we're, I think, more likely to develop some of these compensation patterns if we're returning to dance before we're sort of functionally ready to return to dance, and then setting ourselves up for future problems down the road because of these like compensations that are happening. And so those future problems could be recurrent ankle sprains, but they could also be other issues, like I said, sort of happening elsewhere in the body from compensations. So I just want to like really drive home that point that no matter how seemingly mild an ankle sprain is, it is a significant injury in that we just want to make sure that there aren't going to be any long-lasting consequences from it. So if you take anything away from today's episode, I hope it is that if you or any of your dancers ever have an ankle sprain injury, that you do go get it evaluated by a medical professional to make sure that you are not lacking in range of motion, strength, proprioception, any of those things, so that you can fully recover from it and then hopefully prevent some of these recurrent injuries happening down the road. So I will wrap it up there. I hope that information was useful to you and you found it informative. If you have any questions or further thoughts about that, I would love to hear them. Send me a message. You can find me on all the social media channels at Dance Physio Erika, or send me an email. My email address is in the show notes. Thank you so much for listening, and I hope you have a great rest of your day.